Hello and welcome to Pathways to Wellness. I'm your host, Jude. Today's episode is aptly named Getting Back to Pain-Free. Did you know that an astounding 80% of you watching today have experienced or live with back pain? I'm no stranger to the debilitating impact that back pain has on life. What started out as an untreated mild injury in my youth turned into a decade of misery that has affected me both physically and emotionally. Over the years, I tried everything, including surgery, but what I found that worked best for me is what I ended up basing my practice on. Let's see if we can start you down a path of recovery and pain-free living. Let's start with the symptoms. Back pain can be classified with one or any of the following symptoms. Persistent aching or stiffness anywhere along your spine from the base of the neck to the hips. Sharp, localized pain in the neck, upper back or lower back, especially after lifting heavy objects or engaging in other strenuous activities. Chronic ache in the middle or lower back, especially after sitting or standing for extended periods. Pain that radiates from the lower back to the buttocks, down to the back of the thigh or into the calf and toes. An inability to stand straight without having severe muscle spasms in your lower back. All right, so how do we get you back to pain-free? I cannot stress this enough. Always do what works best for you and your body, and always consult with your doctor about any pain, as it could be a sign of an underlying fracture or something much more serious. Your doctor may prescribe a combination of physical therapy and anti-inflammatory pills. If the condition is more serious, as in a bulging or herniated disc, steroid injections, or even worse, surgery may be required. But before you go down the surgery path, you have alternative options like massage therapy, physical therapy, acupuncture, chiropractic care, or a fairly new process that I use with my clients called Muscle Activation Technique Jumpstart. Muscle Activation Technique, or MAT, is a biomechanically based process designed to evaluate and correct muscular imbalances that contribute to chronic pain and injury. More often than not, back pain is a result of muscular imbalances that are caused by stress, both emotional and physical. Trauma, either new or old injuries, can create residual or referral aches and pains. Dehydration. Our bodies average about 57% of body weight in water. At birth, humans are born with nearly 75% of that and steadily depletes over the next 10 years. Chemicals and toxins, drugs and medications or lack thereof of essential vitamins and minerals. Overuse can also result in an imbalanced muscle structure, which causes other muscles to tighten up and compensate for the compromised muscle. This leads to decreased range of motion, functionality, and pain or discomfort. Through a series of tests, such as range of motion testing and response testing, you can identify compromised and weakened muscles. Through treatments like isometric exercises of those muscles, muscular function can be restored. This leads to stronger functioning muscles, increase in the range of motion, stability, and thus reduces the pain. Today I'm going to show you two basic exercises that will hopefully restore mobility, flexibility, and stability back into your life. Sit up nice and tall, cross your arms over your chest, and what you're going to do is test yourself. You're going to rotate to the right and side bend, bending the rib cage down into the hip bone, and then come back up. What you want to look for is asymmetry between your right and left side. Now turn to the left and side bend, and you'll notice on me that turning to the left kind of makes me stuck. So I'm going to do my isometric exercises for 6 seconds, 6 times, turning to the left. Cross your arms, rotate, side bend from the ribs, and hold the isometric for 6 seconds. 5, 4, 3, 2, 1. Come back out of it again, keeping your spine straight, rotate, side bend at the ribs, and push down into that and keep rotating that shoulder back and hold it. Do it 4 more times and come back out of it. what you'll find is you've strengthened the specific muscle that may have kept you from rotating. And then you recheck yourself. Have you evened out? And if you have, the isometric was successful. The second one that you do on your stomach. Hands should be up by your chest, and you're going to turn your knee out and lie it flat. From this position, try to lift the knee and then bring it back. What you're going to look for is which side is harder than the other. On my left side, which I know my left side's weaker, I can barely get it off the table. So I'm going to do my isometric exercise on the left. Same rules apply. You're going to lift your leg for 6 seconds and 6 times. Eventually, that muscle is going to learn how to contract properly, helping you lift your leg. Back pain can be excruciatingly painful, and there's no overnight solution for this treatment. Remember, it's a process, it's a pathway. You must remain consistent and try not to get frustrated. With the right tools and techniques, you can be pain-free. This is Jude with Insiders Health reminding you to go well, go strong.